Good evening, everyone. Our topic of research is a comparison of school based mental health service provision in Mumbai and Delhi by Shristi Salian and Mehak Lal. One of the most important concerns surrounding the growth and development of children is their mental health. According to the World Health Organization 2020, behavioral disorders are found to be the second leading cause of illness. Thus, there is a pressing need to address this issue. The mental health disorders encompass all the disorders that relate to conditions like ADHD, ASD, depression, and anxiety disorders. Now, coming to the causes of mental health issues, students studying in schools, especially those who are just stepping in adolescence, are at very high risk of falling prey to these mental health disorders. Some of these mental health issues stem from temporary challenges like death in the family, divorce of parents, conflict between friends, or migration to a new region. On the other hand, many children suffer from long term stressors that affect their mental faculties, like living in poverty, being homeless, suffering from violence at their homes, bullying, or abuse. Now, coming to the literature review, it is important that the mental health needs of children are addressed as soon as possible, and the introduction of mental health services in schools is a really efficient way of doing so. Schools can help in the prevention, assessment, and intervention processes. It has been found that the availability of school counselors is directly related to better student behavior in terms of higher learning in school, especially for younger children. Studies showed that the benefits of availing the mental health services for the students, along with good academic performance, were better behavioral, physical, and emotional well being. The first credit in terms of establishing school and community based clinics goes to Tata Institute of Social Sciences. The Central Board of Secondary Education adopted by R.K. Raghavan committee guidelines and made it mandatory to have trained full-time counselor at each level of schooling: primary, upper primary, secondary, and senior secondary. The new education policy 2020 has brought about a monumental change in the education policy of India. The policy has placed high priority for physical and mental health of the students. Help Desk program under the Sarv Shiksha Abhiyan offers a Dropbox facility whereby children can confidentially get support for their problems. In addition to the various policies adopted by the government, there are certain programs by the non governmental organizations, that is, the NGOs, which lay emphasis on mental health programs in schools. Problems in the efficiency of SPMS are that there are no comprehensive nationwide programs, funding providing to them is low, the main focus is still in urban areas, and the role and duties of counselors are vague and undefined. Now, coming to the objectives of our research, this paper aims to conduct a descriptive study to examine the efficiency of the mental health services that have been provided under various state and central policies to school children to help them have a better mental state and emotional development. It looks at two major cities to compare the efficiency and impact of SBMS on the students. The other objective of this research is that it aims to analyze if there are any differences in the impact of SBMS on the students depending on the kind of school attended as well as their socioeconomic characteristics. Now, discussing the sample description, the analysis in this descriptive cross-sectional study is done on the basis of sample of 107 respondents. The data was collected through the survey method using Google Forms to circulate the questionnaire. The data collection was targeted to students between the age of 14 to 18, that is, students studying in grades 9 to 12. The sample has almost equal representation in terms of male and female genders. The sample is also divided according to their residence in either the city of Mumbai or that of Delhi. It, however, does not contain an equal number of students from public and private schools. There were a greater number of students from private schools as compared to those from public schools. This was one of the limitations of the sampling.
Coming to the variables of our study, our dependent variable essentially was a score of the experience of school based mental health services that were received by the respondents. The respondents were asked to rate all these facilities on the basis of 10 aspects, and these aspects included counselor related aspects, which were comfort with the counselor, accessibility to the counselor, time allocation of sessions, trust with the counselor, overall guidance and advice, and help in non school related matters. Other aspects also included the frequency and relevance of these workshops, inclusion of mental health awareness in the curriculum, and an overall effort for the school's effort for providing mental health. So they had to rate this out of 1 to 10, and we cumulated all of these into a score of out of 100, and this was our dependent variable. Our independent variables included gender, city of schooling, existing mental health disorders, number of counselors in school, the type of school that was either public or private, the school board, the school fees, and the frequency of visiting the counselor. So our hypothesis consisted of two parts. There was the city-wise comparison, where we compared across the city of Mumbai and Delhi. And here, our null hypothesis was that there was no difference in the experience of the students while receiving mental health services from their schools in the city of Mumbai and Delhi. And our alternate hypothesis suggested that there existed a difference. A school type comparison was across the schools of across public and private schools, and a null hypothesis stated that there was no difference in the experience of students while receiving the services in public and private schools. And our alternate hypothesis suggested that there existed a difference between the experience of the students of these two schools. So, to test our hypothesis, our analysis basically included a descriptive statistical comparison of means, and we also had a regression analysis where we regressed the cumulative score on other independent variables. We had a dummy variable analysis approach because we had a lot of qualitative variables in our study, and we found out that there was no significant multicollinearity or heteroscedasticity that existed in our data point. The model specification for the regression analysis is given on the screen. So, moving on to our results and discussion, first we have a visual analysis. So, essentially, we have graphs of the average of different categories. So, on the y axis, we have our average of school based mental health services score, our dependent variable, and on the x axis, we have the different categories. So the first, the lighter bar graph shows the city of Delhi, the average of city of Delhi students, and the darker graph shows the students of Mumbai. So the first chart shows that there is the school type comparison. So we can see that students of public schools essentially have rated their experience lower than students of private schools. And then we have a gender wise comparison where we can see that females have rated the services lower than males. We also see that while dividing students according to students who have taken sessions with the counselor versus students who have never taken the sessions with the counselor, the former have rated the services significantly more than students who have never taken the sessions. And this suggests that students who go to the counselor more are more aware about the facilities that are provided by the schools, and thus they are more likely to rate their experiences in a better manner. While comparing across different school boards, we can see that students of IB schools have had a better experience as compared to students of CBSE or state boards. Now, coming to our regression results and hypothesis, first we can see that the coefficients of our gender, fees, frequency of visits, and the number of counselor variables are significant and positive. On the other hand, while testing our hypothesis, we can see that in the city-wise comparison, so here we have taken a dummy variable approach where we have given the value of 0 to students of Delhi and 1 to the students of Mumbai. We check the coefficient of the city variable, which is negative. So this suggests that students of Delhi have rated the services better than the students of Mumbai. However, we can see that the T statistic is not significant, and thus we can not reject our null hypothesis. On the second hypothesis, we have taken a similar approach. We have the private school students as 1 and public school students as 0. So the coefficient of the school type is positive. So this suggests that students of private schools have rated their services better than students of public schools. And also here again we have our p statistic not significant at even 10% level of significance. So we cannot reject our null hypothesis. But there can be a problem here because of the low number of public school students in our sample. So this can be a biased result. Moving on, a few observations that we have come across in our study is that schools